Good evening and welcome everyone. I'm Yasmin Khanam, a clinical dietitian from DS Research Center, Hyderabad. To all those who have joined us for the first time, I take pride to introduce DS Research Center. DS Research Center is a pioneer institution in the field of cancer treatment, founded by two eminent scientists, Dr. Umashankar Tiwari and Professor Shivshankar Trivedi. Their vision was to revolutionize the traditional approach to cancer treatment by tapping into the power of natural human edibles as the primary source of preventives and curatives. Through extensive research, DS Research Center has uncovered the potent healing properties of natural foods and harnessed them to create innovative cancer treatments. The organization has successfully treated numerous cancer patients suffering from stage 4 cancers, extending their lifespan and improving their overall health and well-being. At DS Research Center, our dedicated team of scientists, Ayurveda-charyas, dietitian, medical oncologists, and pharmacologists work together to develop personalized cancer therapies. We are committed to translating scientific breakthroughs into practical treatments that benefits cancer patients worldwide. We believe that the key to maintaining good health, preventing disease, and fighting illnesses lies in the nutrient energy derived from natural foods. Our mission is to continue pushing the boundaries of cancer research and treatment, providing hope and healing to the cancer patients and their families across the globe. So today's webinar is to mark the awareness of sarcoma. Sarcoma is a rare and often misunderstood cancer that affects the bones and soft tissues. Sarcoma is an aggressive cancer affecting both the children and the adults. So understanding the sarcoma and its type is the first step towards finding an effective treatment and improving the survival rate. To understand more about this type of cancer, we have an eminent guest among us, Dr. Vinit Yadav, who is a joint knee replacement surgeon from Institute of Medical Sciences, Banaras Hindu University. Welcome on board, sir.
Hi, Yasmin. Thank you. Thank you for inviting me on this forum.
It's a pleasure sharing screen with you here, sir. So, sir,
Same.
as I have just mentioned, that sarcoma is often misunderstood and understanding it is important for finding an effective treatment. So, I want you to explain to us what sarcoma is and uh, why it is often overlooked.
So, Yasmin, we are talking about aggressive sort of tumor. That's basically osteosarcoma. So, osteo means bone, and sarcoma is a tumor of the bone. So, we are dealing mainly with the sarcomas. When we talk about sarcomas, it involves both the connective tissue around the bone and the bone. Connective tissue means the soft tissues, the muscles, the tendons, the ligaments. So it can arise from any of these. There are more than 70 type of sarcomas that has been seen in the patients worldwide. It might be a rhabdomyosarcoma, osteosarcoma, it might be a leiomyosarcoma. So from different origins, it is named accordingly. So it is one of the debilitating condition. As we know, for any family, any person, any patient, the sarcoma is a very harsh truth for him that there is something bad going to happen with him, and everybody is fearful about this. So in early stages, as we are a very big nation in India and everybody is not having good accessibility of the medical facilities on the medical treatments. So most of the times, whenever these patients they have some problem, something, some swelling, some basic problem, some pain around the knees or some other joint or in the bone or in the soft tissue, they consult a local practitioner or a practitioner working in their village. So mostly these are neglected type of cancers, and for quite a long time, 3 or 4 months, 5 months, 6 months, mostly these patients are treated there only. And the best treatment, best regime for these patients to debilitate, to get some relief in their pain and the swelling, the steroid. So most commonly misused drug is the steroid, which has been used in Indian scenario, especially in the villages. And I see most of these patients coming to us in later stage with steroid treatment. So these patients are often neglected and they don't get proper treatment on the early stages of the sarcoma. So that's the basic issue in India. So the accessibility of medical facilities in India is very difficult. They are living in some remote terrains, so they can't reach a proper doctor. And sometimes, because of ignorance, they are not aware of.
Okay. Thank you for that explanation, sir. Like, yeah. So, can you just emphasize a bit on the key signs and symptoms that an individual should be looking for when it comes to sarcoma, and how can, early detection can make a difference in the treatment?
Yasmin, sorry to interrupt you. Can I know the what sort of audience we are having in this forum right now? Because should I speak in Hindi or English? Because in what language are they comfortable? Because most
Both
of
is
the
fine.
people,
Both is
so it's
fine, sir.
both is
Yeah.
fine. Can we talk in
Yeah, we
Hindi
have
also?
both.
Because yes, because most of the people will be understanding the Hindi will be more convenient for them to understand.
Yeah,
So
sir. That's true.
basically, whenever a patient of a tumor lands to us, he is in so much of pain, जिसको हम बोलते हैं दर्द होना, with restriction of movements, जिसमें कि हम लोग के उसके जो जॉइंट हैं या फिर आसपास के लाइक अगर if it's in his thigh bone, if it is in his leg bone or somewhere around his arm or forearm or shoulder region, so he will have restriction of movement around that joint. And apart from this, he will be complaining of a rapidly progressive sort of swelling. So basically, the concept is that in cancers, there are two type of cancer. एक होता है जिसको हम लोग बोलते हैं कि benign tumor. Benign यानी that tumor won't cause much of problem. That will be limited to that area only. There are very less chances of the metastasis of that tumor. Metastasis means कि ट्यूमर एक जगह से पूरे शरीर में फैलने का डर काफी कम रहता है. So that is called metastasis. So benign tumors have very less chances of metastasis. And in comparison to benign tumors, the malignant tumors, they have very high rate of metastasis. So osteosarcoma or any kind of sarcoma, be it rhabdomyosarcoma, be it a leiomyosarcoma, be it a cancer tumor, that's a sarcoma. So it progresses very rapidly, and there are very high chances of metastasis in these patients. So most of the time, patient goes to his local practitioner with a swelling around the joint or in his bones or in his soft tissues, with a rapid progression in few days, few months. And along with that, sometimes he may complain of pain or he may not complain of pain sometimes. And there will be restriction of movement. The only thing in which patient should be cautious is that the swelling has rapidly progressed. That is a very important thing. In any malignant tumor, the swelling progresses very rapidly in due course of time and short duration of time, short span of time. So most of the time patient says, डॉक्टर साहब एक महीना पहले ही सूजन आई थी और अभी ये काफी बढ़ गई है बहुत ज्यादा अचानक से. एक महीने में ये पहले ही हमने देख पाए और उसके बाद अचानक से एक महीने में बहुत ज्यादा बढ़ गई है स्वेलिंग और इसमें दर्द भी बहुत होना. Apart from the swelling pain, what clinical symptom we see in these patients is that they will have lot of venous prominences around that. So that it will be a tense, hard swelling with lot of venous prominences on that. And that there will be chances of pain and restriction of movement. These are the basic symptoms with which the patient comes to us for cancer treatment.
Okay. Well, I think that's quite clear. And so, from your experience, आपने अगर ऐसा कुछ देखा हो कि like common misconceptions regarding the treatment for sarcoma, तो हम लोग कैसे patients को और उनके family को educate करवा सकते हैं?
So Yasmin, as I said earlier, also the sarcoma are very rapidly progressive tumors, and they are having a very bad prognosis. Up till now, there is no permanent cure of these sarcomas. There is no permanent cure, but yes, in early stages, बहुत जल्दी शुरुआती दौर में अगर इनको हम लोग पकड़ लेते हैं, तो we can have a good life expectancy, we can have a good outcome of these patients, and we have seen the survival of few patients if they were treated early in the sarcoma, early in the cancer stage. They have a very good outcome of more than 60 to 70% of survival rate, 5-year survival rate, what we call as. So if it is diagnosed early and if it is treated as soon as possible, it is diagnosed, the chances of survival of these patients is very. But the only thing in India is that they have to be very meticulous about the things, meticulous about the treatment. They should be regular in their follow-ups and they should trust their doctor, what the doctor is suggesting to them. So that's very important thing because whenever a patient, be it me or my colleague, some anybody, whenever he hears he has got some sort of cancer, so he is most of the time, अरे ये मुझे क्या हो गया? So I won't be surviving this disaster with me. So the back of the mind, it's always there. हाँ ये हमारे साथ रहेगा and I won't be able to survive more. But we have got good treatment. We have got survival rates. Yes, but it's a bit emotional thing for the family and the patient also. But being a doctor, I would suggest whenever you see any swelling around the bone, around the joint, in your soft tissue, around your shoulder, around your elbow, or any part of body, do consult your doctor as soon as possible. Don't wait for a long time.
Well, okay. And so, like, do you want to quote here any sort of resources for their education regarding this?
So the best resource for everybody now, everybody is having internet with them, so they can consult their doctor. Don't Google your symptoms. Don't Google your symptoms. So everybody, like, if you are putting Google में आज आपने डाला कि I have got a swelling around, so Google will definitely tell you are going to die in that's the that's Google always. So you'll be more worried about the things. Don't trust the Google what he is telling. He's not seeing you. He's not uh, examining. You're just putting. Down. So everybody, everything is not a everything is not a cancer. Most of the diseases have been. But yes, whenever you feel, you should consult a doctor. If you are not able to go physically, you अगर आप physically नहीं जाके हैं, you can online appointment as we did in COVID times, and you should consult him whenever it's possible. Hello. So after clinical examination, so the thing is that how to diagnose these cancers. Acha, and next thing, whenever somebody comes with a cancer tumor, he asks, Doctor साहब ये मुझे कैसे हो गया? So what are the causes that causes osteosarcoma or any kind of sarcoma? So the first and foremost is the genetic mutation. Genetic mutation is that it's in your genes. आपके जीन्स में ही है, आपके शरीर में डीएनए म्यूटेशन हुए हैं जिसकी वजह से हुआ है. अब म्यूटेशन होने के there are lot many causes. The cause of mutation in your gene is change in your DNA. That happens while you were born from your parents. It might come the genes from might come from your parents, and there are chances the genes might have been normal, but they have due course of time because of some exposure, like exposure to radiations, exposure to some chemicals, which can cause a cancer and a mutation in the genes. So these are the basic cause for cancer. It doesn't happen like I am eating something and it caused this. No, not that. I am eating sometime patient. Doctor, I am eating a lot of non-vegetarian foods and I might have got cancer because of this. It doesn't happen like so most of these sarcomas are genetically mutated cancers, and it can travel in the family also. If your father or forefather or your siblings were having some sort of cancer, there are high chances you might get cancer in future. So that's the basic cause. And after that, you consult your doctor and we can diagnose this on the clinical symptom with which you are presenting to your doctor. And after that, we can go for some sort of investigation to make a sure diagnosis so that we can plan accordingly.
ओके ओके सर, जब फूड की बात हो ही गई है तो एक छोटा सा सवाल उसके रिगार्डिंग भी हो जाए। लाइक बहुत से रिसर्च स्टडीज में भी बताता है, और लोग जैसे ही कैंसर आता है कुछ फूड्स अवॉइड करना शुरू कर देते हैं। एंड ये भी सुना है कि लाइक कुछ फूड्स जो है, सो कीमो ड्रग्स हो गए, कुछ ड्रग्स के लिए डिफरेंटली एक्ट करते हैं अगर इंटरेक्शन होता है, तो उसके बारे में आप क्या कहना चाहेंगे?
जैस्मिन, बेसिकली कैंसर क्या है? व्हाट इज कैंसर? कैंसर इज बेसिकली आपके शरीर के ही नॉर्मल सेल्स हैं जिनके अंदर म्यूटेशन हो गई है, और इनका जो नॉर्मल एक बॉडी का, लाइक नॉर्मल बॉडी के कोई भी सेल्स है, बॉडी का कोई भी एनीबॉडी, उसका एक, हर चीज का एक टाइम लाइफ स्पैन होता है, टाइम बाउंड होता है, और उसकी डेथ ड्यू कोर्स ऑफ टाइम में होती है और उसकी जगह नए सेल बनते हैं। कैंसर में क्या होता है कि जो भी सेल जो हमारी बॉडी के जो ग्रो कर रहे हैं कैंसर के, सार्कोमा, ऑस्टियोकोइमी, उन सेल की डेथ नहीं होती है, और वो रैपिडली प्रोग्रेस करते जाते हैं। दे डोंट डाई बिकॉज ऑफ म्यूटेशन इन देयर जीन्स, और दे रैपिडली प्रोग्रेस, वो ग्रो करते जाते हैं एंड रैपिडली दे स्प्रेड टू द अदर पार्ट्स ऑफ बॉडी। दे बिकम पैरासाइट और डोसाइट, वो वहां पे भी उस टिश्यूज को, लोकल टिश्यूज को डैमेज करते हैं। दैट्स हाउ द कैंसर। So there are lot many factors, lot many medicines, chemotherapy, radiotherapy, everything is there. Surgical intervention is there for the treatment of these cancers. But yes, they have certain limitations with them. They can work very well in the early stages, but whenever the cancer has metastasized, yes, you can go for radiation or a chemotherapy. But the chances of survival, whenever it has metastasized, are very low. So chemotherapy has a very good role in metastatic stage. It prevents the further growth of these cancer cells in the other sides of body. We can go for a specific site-specific brachytherapy, that sort of radiotherapy given to the local site of the tumor. And whenever possible, at the early stages, we can always go for excision of the tumor, whole tumor. That's what I want to say, the whole tumor with the free margins, tumor free margins, and we can cure the patient also sometime.
ओके ओके लाइक लाइफस्टाइल मेजर्स जो हैं एंड प्रिवेंटिव मेजर्स, कुछ ऐसे आप लोगों को बताना चाहेंगे जो कि दैट कैन हेल्प रिड्यूस द डेवलपमेंट ऑफ sarcoma?
Yasmin, what I would say, as most of these cancers are genetically mutated cancer, but yes, there are certain additional add-on factors which increases the chances of having a cancer. Like smoking is a very known cause for any sort of cancer, be it a cancer of the lungs, be it a cancer of the skin, or sometimes sarcomas also. Alcohol consumption, that is also a known factor for the cancer happening in the patient. And apart from these, exposure to the radiations, and the person which are working in the radiotherapy or radio centers, radiology centers, they are always exposed to higher radiation, so they should get regular checkup of their radiation exposure. And if it shows they are having a very high radiation exposure, they shouldn't go to those places. So lifestyle modification, keep yourself fit, do regular exercises. That's a normal dictum for any medical illness. You should be fit, fine, running and doing all your activities, and don't try to indulge in smoking or alcohol sort of things. So that's the basic thing we can do in our life. Exposure to the surroundings and the cancer causing drugs, the chemicals, the harmful food materials, what we are eating nowadays, they might cause the cancer in these patients. So coming to the treatment part, in early stages of cancer. So first, before treatment, let's come to the diagnosis. How to diagnose? डॉक्टर साहब, मेरे को स्वेलिंग हो रही है इतने दिनों से, और मैं इस पे अभी चल नहीं पा रहा हूँ. इट इज पेनफुल ऑल्सो. Most of the patient come with this complaint, and we clinically examine. As I told you, there will be more venous prominence over that swelling. It will be a tense, hard, painful swelling. Next investigation, we get an X-ray done, or a ultrasound, or a CT scan, or a MRI. These investigations help to make a good diagnosis of the tumor, and to make a confirmatory diagnosis, the biopsy. We take a tissue particle from the tumor, that is called biopsy. उसमें से एक मांस का टुकड़ा निकाल कर हम लैब में जांच के लिए भेजते हैं, और उसके बाद जब डायग्नोसिस कंफर्म हो जाती है, वी कॉल इट हिस्टोपैथोलॉजी जो बोलते हैं हम लोग, उसके बाद जो डायग्नोसिस कंफर्म होती है, दैट इज द कंफर्मेटरी डायग्नोसिस। बी इट इज इट ए बिनाइन ट्यूमर और इज इट ए मेलिग्नेंट ट्यूमर। बिनाइन ट्यूमर यानी कि उसी जगह पे प्रोपेगेट होने वाला है, या फिर एक मेलिग्नेंट ट्यूमर जो कि शरीर में फैलने की टेंडेंसी रखता है। सो अकॉर्डिंगली वी कैन डायग्नोस एंड वी कैन स्टार्ट द फाइनल ट्रीटमेंट ऑफ द पेशेंट। For early stages of cancer, we should go for some surgical intervention like excision of the whole tumor along with the nearby tissue with tumor free margins. ट्यूमर फ्री मार्जिन से मतलब आप उतना ट्यूमर निकालिए, उसके आसपास का नॉर्मल 1 से 2 सेंटीमीटर का टिश्यू भी आपको उसमें से निकालना होता है। और उसके बाद आप पेशेंट को कीमोथेरेपी या रेडियोथेरेपी, डिपेंडिंग ऑन किस तरह का कैंसर है और किस तरह का इसमें ट्रीटमेंट काम करेगा, आप पेशेंट को उसमें इलाज दिया। और एक चीज और नई आई है जिसको हम लोग न्यू एडजुवेंट कीमोथेरेपी बोलते हैं। अगर कैंसर लोकल साइड पे बहुत ज्यादा एग्रेसिव है और उसमें पेशेंट का जो ट्यूमर है वो बहुत ज्यादा एरिया कवर कर रहा है, तो ऐसे पेशेंट्स में बिफोर गोइंग सर्जिकल इंटरवेंशन, यानी कि ऑपरेशन करने से पहले हम लोग उसको 2 या 3 साइकिल कीमोथेरेपी की देते हैं, जिसके बाद ट्यूमर साइज जब रिग्रेस हो जाता है उसके बाद हम लोग उसमें सर्जिकल इंटरवेंशन करते हैं। दैट्स द स्टैंडर्ड प्रोसीजर व्हाट वी फॉलो ऑन दीज पेशेंट। पोस्ट ऑपरेटिवली पेशेंट हैज टू अंडरगो सम सॉर्ट ऑफ कीमोथेरेपी एंड रेडियोथेरेपी। रेगुलर ड्यूरेशन पे पेशेंट्स को हम लोगों को फॉलोअप में रखना होता है। हमारे स्कैन्स की जरूरत पड़ सकती है के लिए, and PET scan is a very well known diagnostic tool for the cancer patients. So sometimes whenever we feel there is some sort of metastasis or cancer has migrated to some other body part, we go for PET scan in the patient to diagnose and confirm, and we treat accordingly. Gamma knife we have used in these patients. Gamma knife is a newer technology where we use radiation to a specific point. If there are tumor migrated to our brain or non-accessible part of the bodies, we use the gamma knife or other radiation procedures to treat those migrated metastatic uh, tumor cells. So that's the basic treatment of these patients of osteosarcoma.
Okay. So, what would you suggest to the patients to minimize the post effects of the treatment like chemotherapy and radiotherapy के बाद जो side effects आते हैं? So, to minimize that, what do you typically suggest in general?
So, Yasmin, there are very known side effects of chemotherapy like hair loss, nausea, vomiting, and irritability, weight loss. So there are very less chances कि आपको इन सब से बचाव हो पाए. So the best thing what we can suggest is to indulge in some his hobbies like doing painting or doing some sort of yoga, and the hair will gradually come up again whenever chemotherapy is stopped. You can definitely use wigs. There are foundations which are providing wigs to these patients, and you have to be confident in life. You have seen so many celebrities, be it political, be it TV actresses or the film stars. They have defeated the cancer in past, and they are still doing good in life. So you have to be positive in life. Be positive, and everything has a cure. Something might not be going towards your side at the moment, but future will be bright. So be positive in life, and think it is as a small time problem for you, and it will gradually go away. There are medications to alleviate all your problems like pain and the medication related problems. But yes, I can't deny a very bad thing for any patient, the side effects of the chemotherapy. So sometimes you have to be mentally strong.
Thank you. Thank you. So I was about to ask you for a take home message, but you have already given that to us. Thank you so much. I would like to, as a dietitian, I would also like to add some points here. So patients who are like suffering with sarcoma or undergoing any treatment, please make sure that you are getting enough of nutrition, focus on getting more of calories, more of proteins, and more of fats, so that you will be better able to maintain and tolerate the treatment, whatever that might be. Eat a good amounts of healthy foods, at least 5 to 6 servings of vegetables and fruits every day, because they are vitamin packed and also antioxidant rich. And patients who are below their ideal body weight, don't underweight. So please do make sure that you include enough of protein in your diet, enough of calories to reach your ideal body weight, and make sure you get an enough amount of calcium. So it would be better if you could get the calcium from the diet you eat, at least 1,000 milligram to 1,200 milligrams of calcium per day an individual should be having. So you can opt for the sources like milk, yogurt, cheese, and dark green leafy vegetables as well. Oats and sesame seeds are a great source of calcium. If you kind of include 1 tablespoon of sesame seeds in any oatmeal as a breakfast every day, it becomes an incredible start of the day. And yeah, if you're going to opt for any calcium supplementation, look for a supplement that has vitamin D in it as well, because we have really few good natural sources of vitamin D, including the fatty fishes like tuna, sardine, mackerel, eel, etc. And yeah, whenever you consume nutrient rich food, please do avoid having tea and coffee immediately after your meal or before your meal, because it hinders the absorption of nutrients in your body. So make sure to follow that. And as the sir has said, so include some sort of light exercises in your routine, so that you kind of make your bones more stronger and more denser when you work. And it will also help you to maintain your ideal body weight and keep you in a good shape. So this brings to the end of the session. But before I conclude the session, I would like to put some light on our holistic approach in treatment of sarcoma. So at DS Research Center, we have a team of scientists, oncologists, Ayurveda-acharyas, of course, dietitians. So we all collectively plan ancient Ayurveda-based nutrient energy treatment for sarcoma. So the treatment for sarcoma depends on the type of the cancer, like the size, the location, and the stage of the cancer, as well as the patient's overall health. So our team weighs the benefits as well as the risks of all possible treatments and then suggests the treatment accordingly. But our treatment approach involves, treating the disease from its root cause. So our researchers have made a great progress in understanding the behavior of the disease and how certain changes at the cell level can cause a normal cell to turn cancer. We have usually found that these changes are acquired during life. So for such cases, we do plan in a way that we correct their changes, those changes and the deviation in the metabolism through our treatment, and as well as they improve their immunity, their lifestyle, and their dietary habits for better prognosis. And in the cases where the sarcomas require surgery, so our treating team would suggest to go for the surgery along with following our nutrient energy prescription for better outcome and minimizing the post effects of the surgeries, rapid recovery, and minimizing the effects of remission as well. So our treatment has no side effects unlike any other treatment, and the cancer management is a long journey. So our team stands by the side of the patient throughout their journey. And we also believe that counseling plays a major role, as mental conditioning of the patient is crucial to prepare them for the crusade against the cancer. Of course, we have proven results in our 65 years of service, reclaiming countless lives from cancer. So while we have made such a significant stride, we still recognize that we have a long way to go. So with this, I conclude the session. Thank you, Dr. Vinith, for joining us and sharing your valuable information with us. I hope our viewers have got to learn a lot from you and from this
Thank
webinar. So it was really a great pleasure having you here with us. Thank you.
Thank you, Dr. Yasmin. It was great to share my experience with the cancer. As I know, cancer is a very debilitating condition and it causes a lot of burden on the patient and his family. It causes a lot of mental stress to the patient and his family also. So, yeah,
Absolutely. Most of the time, also, we feel helpless when the patient comes to us, and most of the time, especially in the cases where the skeletal system is involved,
yes,
so we feel really helpless for for their patient because they will be keep complaining of pain. So that is what makes us sad sometimes. So, but still, as you have said, we can, make better improvements in our treatments, and we can still manage cancer. It's not that deadly disease
yes.
as people think. So, thank you, sir. Thank you for your inputs, and I also thank our viewers for joining us and staying till the end. Once
Thank
again, thank you, everyone. I'll be signing off now.
you. Bye bye.
Bye. Good evening.